There's an intense relationship between chronic pain and sleep disturbance. That's really kind of cyclic and self-perpetuating. And then other chronic neurologic diseases like peripheral neuropathies, where there's numbness and tingling in the feet or legs, restless leg syndromes, Parkinson's disease, chronic headaches, and then cognitive disorders such as Alzheimer's disease. Next. And then there are a variety of prescription drugs that can create sleep disturbance, including some of the antidepressants that are used, cardiovascular medicines for blood pressure, allergy medicines, stimulants, and corticosteroids like prednisone, which can be used for chronic illness or often for acute problems, and in high dose, not invariably, but very commonly cause sleep disturbance. And then non-prescription things that include caffeine and alcohol, over-the-counter decongestants, amphetamines, and other stimulants and hallucinogens, and even some of the pain medicines that people use illicitly, many of them cause sleep disturbance. And not only sleep disturbance, but they alter the natural restorative sleep pattern, and so these people never truly get fully rested. Yes. Next. And then, not every psychiatric condition, but almost always with significant anxiety or depression or bipolar disorder, you see a significant degree of sleep disturbance. And in many people where it's not clear what's going on, profound sleep disturbance can be a simple sign of bipolar disorder, and causes at least me to think about whether that's a possibility for the individual. Next. These are I didn't mention, hormonal imbalance, which occurs particularly for many women during the perimenopausal time, and is often a common cause for sleep disorder and then subsequent fatigue. And it's usually self-limiting, and by that I mean it improves over time, but it's often a very long time and becomes a chronic problem. Primary sleep disorders. Next. So obstructive sleep apnea is relatively common, and particularly, not always because we're overweight, but often. And if you see people with a men with a neck size greater than 17 and a women with a neck size, I think, greater than 15 inches. And if you look in the back of the throat, you see very narrow oropharyngeal opening. There's a high probability that such individuals do have sleep apnea. And if, in addition, they have daytime fatigue, then it's worth doing a sleep study. We now can do for many people, can do them at home, so it's less inconvenient and problematic. Often associated with snoring, and it's caused by narrowing or partial collapse of the upper airway. And weight reduction often produces improvement if people are overweight. And surprisingly, it isn't a question of being truly obese. You could be even 10 or 15 pounds above a good weight for you, and it could be a problem. And we think about it when the person has daytime fatigue and some cognitive impairment, trouble thinking clearly, a history of snoring with interrupted breathing, and then we diagnose it with the sleep studies and treat it in a variety of ways, including weight loss, surgery, and then the continuous positive airway devices that just keep the airway open. Next. And narcolepsy is less common, but it's a disorder characterized by excessive daytime sleepiness and disrupted nocturnal sleep. And oftentimes, such people, you can actually just, they're in a conference room table and they're nodding off, or they're in a movie and they're nodding off, or looking around here. There are some actually very good medications that treat this problem effectively. Next. Circadian rhythm disorders, sleep disorder characterized by the inability to sleep at the traditional times, and this is the classic problem of adolescents and young adults. then again, it's okay for a while, but often as you get older, there's an advanced sleep phase syndrome where you have to, you feel excessive sleepiness in the evening, and you wake up and you go to bed extra early, but then you wake up early in the morning. Shift workers, who constitute 25% of our workforce, often experience this type of disorder, and it can be, I've seen people for whom it really impairs their health. Next. There have been even studies looking at this in women who do shift work and suggesting increased risk of certain cancers like breast cancer. Restless leg syndrome is not that uncommon, and you just have to ask the questions, and then there are therapies that can be helpful. Next. The treatment strategies. Okay. The prescription medicines are generally thought of as being valuable in people for a short-term or intermediate-term use, but they're not considered ideal for long-term use. And one of the reasons, I think, is that there's often a need to escalate the dose, and at a certain dose, they really can cause, not in everyone, but in many people, adverse effects. Often people get up in the middle of the night, don't realize what they're doing, and more than once I've seen people strike their head and actually have significant head injuries. I've had one person who was stopped by the police for driving while intoxicated the following morning. Didn't even realize it. So they can have significant adverse effects on cognitive ability. And again, when used judiciously and for short term, they can be useful. There are certain psychiatric medicines we're now employing in people because of their sedation effect on a longer term basis. And they seem to be okay, but in general, when it's possible to avoid a medicine for an extended or permanent time, it would be a good idea. And one of the big things is that they don't produce a natural sleep cycle, and so it's very difficult to really achieve what it is that we're hoping for with sleep, which is restoration. Next. Antidepressant medicines can be used in long-term patients who do in fact have clinical depression or anxiety disorders, and there is an improvement of sleep quantity and quality with the adequate treatment of depression. And these medicines have been used. Doxepin, which has been around just forever, I mean more than 30 or 40 years, was off patent. Someone actually, they've come up with the, FDA just approved it for use for sleep, but in a tiny dose. The therapeutic dose for depression is 100, 150, up to 200 milligrams. You have an approval for a dose of 3 to 6 milligrams. And of course, now that they have new FDA approval, they could charge a ridiculous amount of money for this tiny dose of medicine that costs pennies if you just get the generic and break the pill apart or whatever. And in some people it's effective, but and certainly worth offering. Next. Many people resort to the over-the-counter medicines. They almost all have Benadryl in them, and for better or worse, they can be effective, but they can have some drying effect on the mouth. They can have some adverse effects in terms of urinary retention, and in people with glaucoma or a tendency to glaucoma, they can have an adverse effect. Next. So then I'm going to talk about the integrative medicine strategies, and they include attention to diet, exercise, stress avoidance and reduction, detoxification, and they're the same factors that produce a general health benefit if applied, and they're not just germane to sleep. Next.